Spine Plus clinics, founded by Robert Shanks and Darren Chandler, offer a combined manual therapy approach that has proven highly effective for relieving common musculoskeletal, sports injury and orthopedic symptoms, such as neck pain, shoulder pain, tension headaches, back pain, sciatica, and many other conditions.
The key to success starts with a good old-fashioned thorough assessment. For example, the sciatic nerve. It runs from the lower back down into the buttock and down into the leg. This is tested via a straight leg nerve test. There's another nerve called the femoral nerve that runs down the front of the leg. Now this is tested via the femoral nerve stretch. Unfortunately, the femoral nerve stretch is not routinely performed, meaning the patient quite often goes undiagnosed.
Imaging techniques such as MRI scans can be very helpful in diagnosing a patient's problem, particularly if they have a disc problem. But it's not uncommon for patients to come to us with considerable discomfort, having had a scan that apparently hasn't shown any abnormalities. Now, Spine Plus, one of the first questions we'll be asking there is, has the right scan, has the right sequence of scans been done? For example, a stir sequence. Now, a stir sequence is a special type of scan that suppresses the fat within the spine and can help to show up inflammation within the tissues that might otherwise be missed. We'd also want to know, have all the findings been reported on? Now, it is a controversial area, but things like disc tears and thinning discs, some people say that these don't cause symptoms, and sometimes, therefore, they won't be in the MRI reports. But we feel at Spine Plus that these things, these subtle signs, can often be directly involved or even indirectly involved in the patient's problem. Now, we work very closely with a leading consultant musculoskeletal radiologist from the Royal National Orthopaedic Hospital in Stanmore, and he often will provide second opinion reports for us. Sometimes, though, a patient's problem genuinely can't be seen on the scan, and this would apply to things such as stiff spinal joints, trigger points in the muscles, subtle problems with the ligaments, biomechanical issues. For example, if they've got one leg slightly longer than the other, or a problem with their foot, which is then causing some strain in the low back. And this is where the thorough clinical assessment is so crucial. Just as we are very thorough with the assessments we offer, we pride ourselves on being equally as precise with the treatment techniques, which include cross-fibre deep tissue massage, intramuscular needling, spinal manipulation, spinal decompression therapy, electrotherapy, and personalised corrective exercise advice.